All right, good afternoon. Welcome to the 88th Texas Legislative Overview. Um, this is going to be a riveting conversation. We're going to introduce Miss Shannon Hoffman. She has her master's in public affairs, master's in social work, and LCDC, is the policy program officer at the Hogg Foundation for Mental Health, where she works on public policy initiatives to improve behavioral health systems in Texas. Shannon began her career as a clinician working with youth and their families. Additionally, she is a family member of siblings with behavioral health challenges and criminal justice involvement. Prior to joining the foundation, Shannon worked for a member of the Texas House of Representatives. All right, I'm going to hand it over to Ms. Shannon.
Can y'all hear me in here? Okay, that's working. Okay. Good afternoon, everyone. Thank y'all for coming today. I know it's towards the end of the day, so I really appreciate you coming and listening to me give a legislative overview on what happened. Hi, everyone. Come on in. Hi. I like your shorts. That impacted children and family mental health this session. We are together. We're slotted for about 90 minutes. So I know I don't want to hear my voice that entire time. So if you do have questions, comments, please feel free to ask me. I am happy to also have this partially as a dialogue. Also, y'all are in for a real treat. It's one of those days. I forgot my notes, so we're just going to roll with it, and y'all bear with me. So thank you for the introduction. Yes, I have some letters behind my name, but I think importantly too, I worked as a clinician, as mentioned, before moving into policy, so have some of that real world on the ground experience. There's sometimes some disconnect between legislation and what actually it means for people doing the work, as well as I am a family member. I have brothers who, within their own capacity, have mental illness, substance use struggles, as well as criminal justice involvement. So a little bit about the Hogg Foundation for Mental Health, why I am up here talking about these things, is we are a foundation that was started in 1940 by the children, an endowment by the children of former Governor James Hogg. And so we have been working to improve the mental health and well-being of Texans for over 80 years now through strategic grant making, research, and policy work. I have been doing this with the foundation for about 5 years now. Our vision is for the people of Texas to thrive in communities that support mental health and well-being, and we hope to do that through transforming how communities promote mental health in everyday life. So a little bit about what we do. We not only educate on policy with legislators, state agency folks, and other stakeholders during the legislative session and after, but also serve on coalitions, advisory groups, work groups. We provide technical assistance to our grant partners who are in their communities on the ground that may want to engage in local policy, statewide or federal. And we have a plethora of policy materials. If you don't feel like reading bills, you don't feel like going through the 1,000-page budget, we do that for you. And so just by kind of a show of hands, so I know about how many people in the room engage, follow the legislature this past session or have previously. Okay, great. So have some folks in here that this may be like a duh moment, but I know before I, as previously mentioned, worked for a legislator for about a year, I had no idea about how the Texas political landscape, the legislature worked. I thought I could call Ted Cruz and he would help me with my roads, but that is unfortunately not how it happens. It's not that simple. And so our state government in each state kind of does it their own way. We meet for 140 days every 2 years. That's including the budget as well. And so our legislative session just wrapped up about 2 months ago, at least the regular session. We worked from January 10th until May 29th. And even after bills pass, after the budget passes, the veto does have power to line item veto the budget, so he can go through and just pick certain things that he wants to not pass through, as well as veto complete pieces of legislation. And he has that authority through June 8th. The legislature did have 2 special sessions from sine die May 29th till mid-June. What the governor called the special session for did not come into fruition, so he called a second special session, say that 10 times fast, on property taxes and immigration. And so they wrapped that up mid of this month. But that's not something that we, the Hogg Foundation, participate in. And so if there are things that the governor feels like there needs to be additional legislation passed on, some of his major priorities, he can call special sessions, which are limited 30-day mini sessions that can only pass legislation on those specific topics. And when I talk about the Texas legislature, we have 2 chambers, the Texas House of Representatives and the Texas Senate. The senators serve for 4 terms. We have 31 that represent the entire state of Texas. And then the Texas House of Representatives serve for 2 years, and there are 150. On the Senate side, Texas is made up of 19 Republicans and 12 Democrats. And on the House side, I'm going to try to remember my math, 64 Democrats and 86 Republicans. And the folks who are often mentioned in the news, our leadership in our state, also referred to as the Big Three, are our Lieutenant Governor, Governor, and Speaker of the House. The Lieutenant Governor and the Governor are on our ballot every 4 years. And currently that is Lieutenant Governor Dan Patrick. He presides over the Senate, and Governor Greg Abbott. The Speaker of the House, though, is unique in that they are chosen amongst the elected representatives, and they serve for 2 years. We do not choose him, the House members choose them. And I just wanted to give a visual representation of how a bill gets passed into law. It is a very convoluted process. It is not easy. This session, we had over 8,000 bills filed, and about 1,200 of those passed. So it is really difficult, for better or for worse, to get a bill passed, especially if it's complicated, if it's potentially controversial. It can take some time. On average, sorry, I want to back up. And when I go through legislation, even though there are many more bills that didn't pass than passed, even getting a bill filed is a win. On average, it takes 3 sessions, so 6 years to get a bill passed. And that's average. It can take more. And so as you can see, a bill from the beginning, and then there's more before. It has to be written, it has to be filed, but once it's filed, it has to go through all of this process to become law. And then, like I said, the governor has veto power, and all of that work could be done, and he could say, no, not feeling it, and veto it. And so, like I said, too, for better or for worse, you can see all the little like the stop sign hands, and those are opportunities or unfortunate possibilities of where a bill can be stalled or killed, as it's called in the legislative world. And so with that, I just want to pause. I know that's a lot of information, but just kind of wanted to set some groundwork so y'all that aren't as familiar kind of understand the landscape that a lot of us are working in, and also to just kind of give a disclaimer of why more bills that we have in the presentation did not pass than pass. Does anyone have any questions at this point? Okay. So the first bill that I wanted to go through is the budget. Every 2 years, like I said, a new budget is created and passed, and it funds the next biennium. So the budget passed the end of May is going to fund fiscal year 24-25. So fingers crossed that it is sufficient or makes sense for 2 years. It's kind of wonky how that works. And like I said, the budget is over 1,000 pages. This is not in any way, shape, or form all-encompassing of that, but did my best to scour those 1,000 pages and really pick out the things that will not only be impacting mental health, but more focused on youth and families. Okay. So the way that the budget is organized is through articles, and each article has a basic theme of the state agencies that it funds. So for the sake of this conversation, Article 2 is kind of where a lot of state funding that impacts mental health is funded through, and that is through the Health and Human Services Commission. Article 2 funds the Department of State Health Services, Health and Human Services, and DFPS. So we're looking at HHSC. And these are the funds, most of them like the community mental health, the crisis services, some of the substance use services, community grants, and hospitals flow through the local mental health authorities, or LMHAs, and HHSC gives authorities to those entities within their encapsulation area to serve indigent and low-income populations. And so fiscal year 22-23, that was last session, but that is what's currently funding us. And then what just passed in May is what will be funding fiscal year 24-25. And as you can see, all of the numbers on the difference show that the legislature did continue to put in investments in our community mental health system. From adults to children, over $100 million in community mental health for adults was increased, about $30 million for kids, over $100 million for crisis services, 57 in substance use, and really the big price tag that the legislature funded is our state hospital system. As you can see through the state hospital and community mental health hospitals, collectively that increased by $500 million this going into fiscal year 24-25. Some information I wanted to then pull out of those numbers. So this is not additional dollars. These are instructions, essentially. So riders are instructions that the legislature give the state agency on, we gave you X amount of money, this is how you need to spend it. And so one of those is Rider 48, which funds our community mental health grant programs. And most of these have already been in existence, created in previous legislative sessions. And so $20 million will be going to the veterans and their family grant program. $80 million for reducing criminal justice involvement. You may be more familiar with these being called the Senate Bill 292 grants, with $10 million going to the most populous county, $45 million to the Community Mental Health Grant Program, also known as the House Bill 13 grants, $23 million to Healthy Community Collaboratives, and $15, this is a new program, to an innovative grant program to support community-based initiatives for children and their families. This is a new grant, a community grant initiative that was created out of Senate Bill 26, which passed. And with the passage of the bill, there's an additional $15 million. So altogether, this program will have $30 million for communities to potentially have access to for grant programs. These are community matching programs. So depending on the county in which the entity is within, will determine the matching amount. So most urban, larger communities, there's a 50% matching requirement, and then it goes down from there. The really neat thing I think about the new children and youth grant program is regardless of any of that, the match that is required of the entity partnering with the state is only 10%. So there is less of a match requirement. So my hope is that this kind of opens the door for who can apply for those grants. Because when you're thinking about the criminal justice involvement, it could be a 50% match of what the state is providing, which could be a significant amount. And then Rider 52. This was a multi-page rider, and so tried to condense it down to one slide. Like I said, there was a significant increase in the amount of money given to HHSCs, so the legislature had some priorities on what they thought those funds should go to. And this does a good job of reflecting that. The budget is always a good reflection of what the legislature sees as priorities. And so starting with workforce challenges, especially really in all areas, but really in the behavioral health world, workforce challenges have been discussed kind of over and over. We have empty beds offline. The demand is really exceeding the number of folks that are able to provide those services. And so in this budget, there is $134 million going to state hospitals for their staff and over $2 million to the state supported living centers. Further, they really looked at beds in communities and put in buckets of money for contracting beds with some specificity to rural communities, to urban communities, Uvalde, the John S. Dunn Behavioral Health Sciences Center, Sunrise Canyon, and some specific contracted beds for kids in DFPS conservatorship. There was 20 beds funded for that specific population. And then we know that a lot of, unfortunately, we see folks cycle in and out of systems because they're not set up for success upon discharge. And so there has been some funds specifically earmarked for transition teams at each state hospital. So each state hospital in our state, once these funds get funneled out and the state hospitals have an opportunity to hire someone, every single state hospital is going to have a transition team to help folks get set up once they are transitioning out of the state hospital. And one of the things that they heard continuously is, even with these teams, like someone coordinating, what happens when there's nothing there? And housing was a really big part of that. And so there's going to be $17 million to expand some step-down housing for folks coming out of the state hospitals. Another area that the legislature prioritized was crisis services. And so there's significant funds for some crisis stabilization facilities and some targeted dollars for certain places within the state to 3 local mental health authorities, the one serving Galveston, the one serving the Heart of Texas region, and the one serving Montgomery, Walker, and Liberty counties. There are funds that are going to be creating 4 new youth serving crisis respite areas. Crisis respite units. And additionally, there will be a pilot of 3 that are specifically peer ran. So where those are going to be, the HHC hasn't decided yet from our understanding, but we'll be interested to see how and where they decide to see the areas of Texas that are in most need of those. And within that vein, some funds were created for youth mobile crisis outreach teams, with 4 specifically funded to be for kiddos involved within the DFPS system. And lastly, there are funds specifically for certain therapeutic interventions that they have under the title of high-risk youth, being multi-systemic therapy and coordinated specialty care. And lastly, there are some funds that, unfortunately, after the tragedy in Uvalde, there were 2 special committees on each chamber to specifically look at what's going on, what are some solutions from experts, inclusive of behavioral health stakeholders. And one of the identified solutions that they decided to fund was a behavioral health campus in Uvalde. I know it's a lot of information. These slides are available, so don't feel like you have to be like breaking your hand to write down everything. Does anyone have any questions at this point? Okay. And so while I did focus on Article 2 and HHSC, since those funds are very specific to community mental health, crisis mental health, there are some state agencies across the budget that there are some riders that are specifically allocated for mental health. Specifically, there's some funds that will be going to the local mental health authorities to also support their workforce challenges, which is inclusive of the local behavioral health authorities and the local intellectual and developmental disability authorities. Currently, HHSC receives funding to provide crisis respite for folks with IDD and mental health. That funding has continued. DFPS currently has a mental health services team, so there will be some data collection that will be coming out. In the Texas Education Agency, while they don't receive any funds specifically for mental health, that is where Communities and Schools is funded. They got a slight increase this session. The Texas Partnership for Out of School Time, they were provided some funds for after school mental health programming. And also within the Texas Higher Education Coordinating Board, the Texas Mental Health Care, the Texas Children's Mental Health Care Consortium, which does a number of things and was created 2 sessions ago, received a significant influx of funds, particularly within the TCHAT program, which is the Texas Children's Access Through Telemedicine, which connects schools that decide to contract with the consortium. It provides their school telehealth access to a mental health professional, namely probably a psychiatrist, that may be able to provide those immediate crisis services provided through telehealth. They also do a number of other things listed here. Article 4, which funds a lot of the criminal justice type of state agencies, courts, TJJD was provided some funds that will specifically fund mental health services for probation departments, continues funding the Children's Commission and the Judicial Commission on Mental Health. And lastly, one of the things we're really excited about is Texas currently has a strategic plan for mental health, and there will now be a separate plan for specifically children's mental health to look at what are we currently doing, funding, what are our real gaps, challenges, barriers, and having a statewide coordinated effort to address those. Children, through that strategic planning, a lot of times children were kind of an afterthought or encompassed within just a general mental health conversation. But we know children aren't just little adults. There's specific and certain interventions, supports that the kid and the family need. And so now there will be a specific, separate strategic plan for kiddos for the state. And the last piece of information I'm going to throw at you with numbers is the supplemental appropriations bill, Senate Bill 30. And so the budget bill is giving funding for 2 years over the biennium. The supplemental appropriations is really more one-time focused funding without guarantee of continued funding. And so within that, almost $1 billion has been allocated for state hospital construction and expansion. HHSC received over $2 billion within the supplemental, but that was inclusive of updating security, updating electronic health records, et cetera, et cetera. But over $1 billion of that is specifically for construction and expansion of the state hospital system. It is mostly adults, but I did pull out the funds or the specific mention of services for kids. The Uvalde Behavioral Health Campus, it doesn't specify how many beds, whether it's for adults or kids, but there's an additional $33 million within the supplemental appropriations, as well as funding for 35 adolescent beds at Terrell State Hospital and 24 adolescent beds at North Texas State Hospital, the one in Wichita Falls. Additionally, not inclusive of the community matching grant programs that I previously spoke about, but there's an additional $100 million for community mental health programs and Children's Hospitals Construction Grant Program. And lastly, a really big investment in school safety through TEA, over $1 billion in grants, and school safety has yet to be defined. So that might be an opportunity for schools to kind of weave in school climate, mental health, if that's what they choose. And with that, that was 1,000 pages really stuffed into 30-ish minutes. And so you're welcome for reading the whole thing for y'all. But at this point, does anyone have any questions about that funding? Is there anything that you feel is helpful for the group that maybe I missed, that your organization or you individually saw, worked on, etc.? Yes. Oh, sorry, they can't hear you.
You mentioned that Children's Mental Health Strategic Plan Committee. Who's part of that board, or how does that work?
They're state agencies that receive funding for mental health, as well as some other the local mental health authorities. It's a list of organizations and state agencies that come together that create the strategic plan, and they are housed within the Office of Mental Health Coordination at HHSC. But at least all the interaction I've had with them, as far as the coordinating council in that office, they often, and more likely than not, always like to engage with stakeholders and people on the ground. And so, like I said, this passed in the end of May, and as they become formed and do the work, I think there's going to be plenty of opportunity for stakeholder input. So I would keep a lookout for that. Yeah. Okay. So now we're going to jump into looking at legislation that did and didn't pass. Specifically, thought it would be of interest for this group to start with legislation that will be impacting schools. And so again, we will be providing these slides, so don't feel like a need to rush and write down all the numbers. But these are a handful of bills that did pass and will be implemented going into next school year that we see having an either obvious impact or maybe not so obvious impact to mental health, behavioral health in the next school year for kids and teachers or other adults in the building. House Bill 3 is really seen as the comprehensive school safety bill that passed through a lot of conversations, starting with the two interim committees looking at specifically spurred from the conversations of the tragedy at Uvalde. And the bill in its entirety went through a lot of changes, a lot of iterations, but really landed on in passing with a focus on hardening and school safety. It has a number of facility updates that are required of schools as far as doors, entries, etc. It will establish an Office of School Safety and Security at TEA. There is a requirement from this bill that every campus have an armed person there during school hours, whether the school decides to hire a security officer, a school resource officer, or having a teacher armed through the school marshal program. That will be required of every campus K through 12. And the, I think, hopefully, shining spot in this bill is that every staff member who has regular interactions with kids will be required to have some type of mental health training, not to diagnose, not to treat kids, but really meant to identify, like, hey, maybe we need to connect this kiddo to some support. And what type of training, how many hours, none of that's named, but every school personnel who has regular interaction with a kid will be required to take some form of training. And the funding formula of the school safety allotment, which in its allowable uses does have some mental health school climate uses. That has been changed to every campus will be getting $15,000 and then $10 per student to decide on how to use that bucket of money to not only adhere to these new provisions that are required, but we hope also have an opportunity to continue with some of the programs and initiatives that we know a lot of schools have created using their ARPA funds, the federal COVID relief dollars. We know a lot of schools use those funds for social workers, for crisis response. So these funds can continue that, but it is at the discretion of the school and how they use that bucket of money. House Bill 763, this has been in the news regularly, so you may be familiar with what it does, but it did pass and allows public schools to allow a chaplain to volunteer or be employed at their district to provide support services and programs to students. And whether they're not required, but whether a school does this or not will be at the decision of your school board. And every school board will be required to take a vote on this within the first 6 months of passage. So that'll be at the end of November. Did I do my math right? So that did pass. In that vein of workforce, Senate Bill 798 also passed, which removes the requirement for classroom instruction experience from a requirement of becoming a school counselor. So previously, school counselors had to have 3 years of classroom experience, and now they are no longer. As long as they're licensed, have the mental health professional schooling, et cetera, that is required to be a school counselor, that is all still intact. Just that professional will no longer have to be a teacher for 3 years first, with the hopes that more folks that are mental health professionals will choose to do that in schools without having to be a teacher first if they don't choose to do that. One of the things that I failed to mention during the budget is there is a mental health loan repayment program for professionals, which is really exciting, got a bump up in funds. And so if someone decides to go into the mental health professional track in school, there is an opportunity to have to receive some funds to pay off your student loans if you choose to work in a mental health professional shortage area, which we know is most, if not all, of Texas. There was a loophole that maybe a state hospital wasn't considered a professional shortage area, even though the surrounding county was, but now those are eligible. So if there's an entity within those counties that are mental health professional shortages areas, including local mental health authorities, state hospitals, schools, et cetera, they're eligible for those funds. There's a list of professionals that I cannot name off the top of my head, but licensed specialists in school psychology are now eligible for that loan repayment program. Again, hopefully to help with that workforce pipeline into schools. I think there's a question in the back.
Okay. How is that different than the public service loan forgiveness program? Do they work like, yeah, what does that look like?
Yeah, sure. I will do my best to give a very high level, but I'm not an expert. My director of policy is a guru in this, and so I can always connect you if that's something that you're interested in finding more out about. This is through the state. The loan forgiveness is federal. And this isn't necessarily like after X amount of years, the remainder of your loans are forgiven, which is through the federal program. This is if you work within one of these licensed professions and you work in a mental health shortage area, you will get X amount of dollars for 3 years. There's a set amount, and depending on the profession, like psychiatrist gets the most, and it goes down depending on your profession. You get X amount of dollars for those 3 years. Does that kind of help? Okay. Yes.
Similar question. I just got in the chat, how would we find out more program?
I'm happy to share like the link with HHSC, Texas Systems of Care, if they want to send it out, but also it is through the Texas Higher Education Coordinating Board. I think we had a question up front. It's people that have already taken out the loans, yeah. I'm so excited y'all are excited about this program. There's an increase in funds, so it needs to be used. So then in the next session we can go, look, it all got used. So happy to share more information with the group too. But the Texas Higher Education Coordinating Board is where the application is through and who receives the funding. And it would have more information. And I will say too, you want to, shameless plug, we have like a legislative summary, one-pagers on this particular program. If it's easier to go through our website, yeah, we have materials on this specific program too. Okay. Trying to remember. There are certain parts of House Bill 3 that went to an immediate effect. Some of them are tiered, like the mental health training, and I'm just trying to remember off the dome, is X amount of your staff has to be trained by 23-24. By 24-25, it's a tiered process. So are the facility standards. The chaplains, it was an immediate effect. School boards have to take a vote within 6 months of bill passage. So it passed in May, June, July, August. Yeah, November. So they all, unfortunately, there's not a uniform implementation date on all of them. And even within bills, certain sections of the bill are implemented at certain times. But if there is something specific that you were wondering about when it would be implemented, I'm happy to follow up with you.
I just had a quick question about House Bill 3. Does that apply to counties that operate JJAEPs, or does that only apply to local education agencies?
That is a good question, and I can find out for you and follow up because I'm not sure. I believe it's all, if it's operating under the ISD, but I will find out for sure for you because I don't know. Great questions. Thank y'all. Anything else? Okay. And so, okay, went through that. The last two are really are looking at providing more education to students on substance use, specifically opioids, overdoses, etc. 3908 will require 6th through 12th graders to be provided annually. Research-based instruction related to fentanyl abuse prevention and drug poisoning awareness. It also gives authority to the governor to designate a week of fentanyl poisoning awareness week. I don't believe he has yet, but it does grant him the authority to. Senate Bill 629 will require schools that are serving kids 6 through 12 to have some policy on opioid antagonists. What do we do? How do we get it? Are we going to keep it? Who's in charge of administering X, Y, and Z? So they are required to have a policy on all of those things. And schools are able to, if they want to, lower grades can have these policies too, but it is permissive. So K through 5 can have these policies. 6 through 12 have to have these policies. So these are the bills that passed that we see having an impact on mental health and well-being in schools. And so for the bills that did not pass, like I said, shouldn't always be discouraged if a bill doesn't pass. It often takes 3 sessions for a bill to pass. Sometimes just getting a bill filed is a win. Having a hearing on the bill is a win too, whether it's forced or they want to have a conversation on issues. When a bill gets a hearing, it is open for public comment. And if you register, you have to be heard. In theory, there have been members that have given a cutoff, but in theory, every person has to be heard. Starting with House Bill 98, which this was the second, because it wasn't filed last session. So this is the second time this bill has been filed. It made its way through the House, but it would have allowed school districts to bill Medicaid for SHARs, for behavioral health services for any kid enrolled in Medicaid, not just kids where those services were required under their IEP. And House Bill 516, as well as House Bill 4449, were 2 bills that really looked at discipline, one on better data collection on law enforcement interactions with kids, and the other one would have created a task force to just look at disciplinary practices and come up with some solutions and recommendations, and neither of those passed. There were a few bills that were filed that looked at excused absences in schools for mental health. We've kind of seen this slowly but surely catch different states. Unfortunately, not too many have them, but we have seen an increase in states pass these type of legislation. And there were 3 bills filed on this issue. So I think that's promising that there's at least some appetite to have the conversation that if a kid misses school for mental health reasons, appointments, that could be excused. As it stands now, if a student returns with a note, that is excused. But that's the only instance in which it can be excused. And from our understanding, even that's great because it says like medical professional, and we have heard some school districts saying that doesn't include mental health. So there's some gray areas. So there was a bill to clean that up, but unfortunately it didn't pass. But it is an allowable excused absence when a kid returns with a note. House Bill 2451, it was one of 3 bills filed that would have created a mental health allotment that would have given schools money dedicated to mental health on a student-to-student basis. Like I said, unfortunately, TEA does not receive any dedicated funds for mental health. There are funds that can be used for mental health, but no dedicated funds. And there were 3 bills filed that would have created this, and there was a lot of conversation. So our understanding, there will be an interim charge at some point in the fall for the legislators to talk about it, and what are some potential solutions going into next session. One bill we did want to include that some stakeholders had some real concern about, that it got through the House and through almost to the Senate. It did not make it on the last day of session. So it was about this close from passing. It would have required parental consent for psychiatric and psychological exam tests or evaluations, which on face value, yes. And we know that's happening. But what this bill did was expand the definition of what those are. The original version could be interpreted as a teacher asking, "How are you feeling?" And there were a lot of changes though along the way. And the last version that almost passed would have been any time. So if a kid was going to talk to a school counselor, a school social worker, T-Chat, potentially their teacher, there would have had to be written parental consent every single time. So something, if you are involved, to look out maybe for next session, because we have a feeling that, encapsulated in parental rights, this bill was really pushed pretty hard. And so that was legislation impacting schools. Does anybody, and thank you for your questions throughout, but are there any other questions at this point before we move into really looking at systems involved youth? Okay. So are a handful of bills that did pass, really impacting the juvenile justice system, DFPS system. I will say the Hogg Foundation does a lot of support work in this area. There are organizations that are only dedicated on the child welfare system or only dedicated to the juvenile justice system. But we do our best on supporting their work on like how this impacts mental health. And so if I don't have the answer to some of these questions on these bills, I know someone who does. So I just want to give that disclaimer. House Bill 1585 was a bill that I know a number of stakeholders were involved in. It made some changes to Chapter 55 of the Family Code, which there are some changes to the juvenile court proceeding for children with mental illnesses and intellectual disability. House Bill 1819 does remove the authority from political subdivisions from instilling a curfew. So no longer kids under the age of 18 can be ticketed for breaking curfew. There cannot be curfews in political subdivisions anymore. Senate Bill 24 was one that was discussed quite a bit during session, and it is moving prevention and early intervention program services, that unit, from DFPS. It will be now at HHSC. And also, it's not in the caption of the bill, but it does, and this is a part that we weren't necessarily involved in, but it does put in statute the Alternatives to Abortion program, which is now called Thriving Texas Families Program. So it also will be at HHSC. Senate Bill 1727 really looked at, there was a sunset review of the Juvenile Justice Department. I had to take a few different times to read that. Incredibly heartbreaking, some of these conditions the kids are in. And so it does continue the department to be then reviewed again in 2025, and took some of the policy recommendations from the advisory commission in the interim. And so between now and the next session, essentially, there are some requirements of the department to make some changes that were brought to light during the previous sunset process. And lastly, Senate Bill 1849, they are currently in the process of creating an interagency child protection database. And so this, the intention of this bill is that staff who may have, it also stemmed from the Juvenile Justice Department sunset review. If there are staff that got in trouble in one state agency, they cannot now just go to another state agency without there being a database for former employees that have engaged in abuse, neglect, exploitation, and misconduct. And that will be between TEA, TJJD, DFPS, and HHSC. So there will be a database to hopefully weed out anyone trying to go from agency to agency that have really created some harm for kiddos. And I'll pause. Any questions on those? Okay. And so some of the bills that did not pass, House Bill 16, a lengthy bill, was meant to really look at, I'll say House Bill 16 and House Bill 4356 in different ways really looked at reforming the juvenile justice system at a whole in different ways. House Bill 16 would have really forced the state to have an intervention and diversion plan and create a county reinvestment funds to keep kids out of incarceration. And House Bill 4356 would, by 2030, completely shut down TJJD facilities and instead create an Office of Youth Safety and Rehabilitation under HHSC and would have had smaller rehabilitative facilities across the state so kids were closer to home if they really were truly a danger to themselves or others. House Bill 506. This was the second, possibly third time this bill was filed, and really would just allow kids during their judicial proceeding to be able to be enclosed and not shackled in front of a judge, because trauma-informed approach that can create some preconceived notions of the kid if they are in certain apparel. House Bill 2822 would have studied the housing needs of youth transitioning out of foster care and out of the juvenile justice system, because we know that is a huge gap and barrier in our state. And lastly, bill, good intention, some unintended consequences, concerns, but still had some really good dialogue, was House Bill 4091, which would have expanded the circumstances under which DFPS would have been authorized to request the admission of a minor in managing conservatorship into an inpatient psychiatric facility. So those are some of the bills that did not pass. Any questions on those? Okay. And then moving forward, some like others that didn't really fit within those. House Bill 12 passed, which is a huge win for our state, following a lot of other states, but still nonetheless, huge win for Texas. Folks who give birth, them and their kids are now covered through Medicaid for 12 months postpartum. And we know that mental health concerns, overdose are often, statewide are the second leading cause of maternal mortality within the first year of giving birth. And so now moms and babies are covered for an entire year after birth through Medicaid. Very exciting. House Bill 113 is, from our understanding, really an administrative cleanup bill to hopefully expand the opportunity for there to be community health workers in communities. House Bill 567, also known as the Crown Act, prohibits discrimination based on race-based hairstyles in the education, both K through 12 and higher ed, labor, and property codes. So it impacts a number of entities that they can be cited for or provides protection for folks against discrimination based on hairstyle. House Bill 900 was a bill that you may have seen in the news quite a bit, but does a number of things, but really looks at books in school libraries and defines obscenity in a relatively broad manner and gives books different ratings. And though it's not in here, it also has a lot to do within your specific school board. There's some authority there. Senate Bill 14 also was a bill that was discussed at length throughout the session, and it prohibits physicians from providing gender-affirming care for transgender youth, as well as prohibits healthcare plans from reimbursing for these treatments. And lastly, it prohibits public funds from going towards gender-affirming care. Senate Bill 63 will require HHSC and the Texas Veterans Commission to collaborate in creating an instruction guide for family members and caregivers who may have a loved one who is a veteran struggling with mental health concerns. And then lastly, Senate Bill 532, it talks about the loan repayment program for health professionals. Previously, someone would have to get their loan repayment dollars over 5 years, but now it has been reduced to 3. So folks will be able to get more money quicker, which is exciting. And then lastly, some bills that didn't pass, though, typo on my end, but probably because it was in the budget. Senate Bill 26 did pass, which is the bill that creates the Innovative Grant Program, and also does some new things with the local mental health authorities as far as audits and reporting. there too. So I did just want to, I know it's within the budget, but just wanted to say that that bill passed, though I don't have it listed here. And then lastly, some bills that did not pass, starting with House Bill 15. It would have created the Mental Health and Brain Research Institute of Texas, really focused on the brain science behind mental health, would have created that institute and really pushed forward the research on that. House Bill 340, which this was the third session that this bill's been filed, but it would required insurance coverage for the diagnosis of serious emotional disturbance. Since serious mental illness is in the insurance code, it does require insurance coverage for those diagnoses, but we know those are 18 and older. So this would really just make sure that coverage for kids was at parity with adults. House Bill 1578 would have created a health literacy plan because we know health and mental health and the language is not easy to navigate. And so really would have helped communities, we feel, with seeking care, advocating for themselves, etc. And some other things that didn't pass is really specific to providers and reimbursement for certain services. Multifunctional family therapy and functional family therapy, multisystemic therapy, sorry. Those two services are not reimbursable now under Medicaid, but there were bills that were filed to make those Medicaid reimbursable. And there was also a bill filed that would have allowed licensed mental health professionals under supervision, like LPC associates, LMSW, be able to bill for services under Medicaid if, again, they were under supervision. And with that, I know that's a lot of bills and a lot of information on the budget, etc. But I did, like I said, want to make sure that there was time for questions. If there was anything anyone was interested in hearing more about, I am happy to answer those at this time.
I don't really have a question, except I do have a comment, and
Okay.
I talked about this at another breakout session, so my apologies for those people who are hearing it again. But I think with the passage of Senate Bill 14, all of us who work in children's mental health, we really need to pay attention. We're going to see a trickle down, like not being able to provide gender affirming care to some of those kids. We know how deeply impacted. I mean, they're more likely to die by suicide, experience depression, homelessness, and it's just a huge issue in Texas, and it's unfortunate that our state doesn't really care about kids in this population. And I think those of us in mental health really need to educate ourselves, to prepare ourselves, because some of us are already seeing the impact of that right now.
No, thank you. I really appreciate you bringing that point up. Yes.
So just quick question of kind of talking about what she was. So was that a bill that was implemented right away, or is that something that's going into effect at a later time?
I will look. From my understanding, it wasn't something that took effect May 29th. I will look, but I think it's one of the bills that is to be implemented starting September 1st,
Okay.
which is like the standard date, but I will double check for you.
Sorry, it's a two-part question.
No, go ahead.
And my second part is that, so like if someone is already under care with a physician for these services, do they like immediately have to stop, or how is that going to work? Because I know that obviously that type of treatment, you may not just want to cold turkey, right? So I didn't know if they wrote anything about that.
It was a conversation during the creation of the bill. It was an amendment that was added but was later stripped. So there is no exceptions for continued care.
Locally, at least here in Austin, practitioners are with minors aren't able to provide. They've already stopped some of the hormone blockers and things like that. So locally, that's what's happening.
Yeah, I would say like intentional, unintentional consequence of that is, yeah, even though there is an effective date of, say, September 1st, like you were saying, there are some consequences in stopping that care immediately. So there have been some providers, whether out of fear or out of best practices, starting now to be impacted by the bill.
Already. Because Ken Paxton has well, before everything that happened with him, but he has started investigating some folks, so.
That's interesting, huh?
Yes.
Investigating.
Yeah.
But yeah, that's really weird. On the 900, the language is really weird, sexually relevant. Who has the power to say that, or who has the last word to ban books?
For the publishers.
For publishers, so they will.
I'm not an expert in this area, and I haven't done like a full deep dive and analyzed the bill in quite a while. But from my understanding, there's like a rating system for those.
So it won't be, say, school boards or parents groups that will say that, because I mean,
Yeah.
I don't know. To me, that's very. It doesn't tell me exactly what's going on. Who's the ones that are gonna do that? If boards are gonna get involved as well,
Yes.
parent groups.
Yes. My understanding that sexually explicit and sexually relevant are not defined. Obscenity is defined in a broad way.
Okay.
But yes, we've seen already before the passage of the bill where school boards, community members bringing books to the school board and saying X, Y, and Z, this needs to be removed. And we've seen all varying impacts dependent on how the school board receives that information. Thank you all for your questions on those. Does anyone else have any questions, comments?
Real quick, I just wanted to say you did an excellent job. This was very,
thank
very
you.
helpful and informative.
Thank you.
It's really good.
And I didn't know if there was anything online that had questions or anything. Okay. Well, thank y'all for your time. I know that was a lot of information. I think the slides are already provided online at the conference website, and please feel free to look at the Hogg website where we have a lot of more deep dives and more information if this is something y'all are interested in. Thank y'all so much for being here. Thank you.